Good morning, everyone. My name is Dr. Dina Mostafa Mohammed. I am a researcher at Nutrition and Food Sciences Department at National Research Center. I am from Egypt. It's my pleasure today to join as a speaker of this global academic event, the Asian Conference of Science, Technology, and Medicine. Today, I present my presentation with title, let me share it. Polyphenolic rich fraction of Physalis, peruviana, Calyces, and its nanoformulation induces apoptosis by Caspase 3 upregulation and cell cycle arrest in hepatocellular carcinoma. Outlines, introduction, aim of the work, materials and the methods, results and discussion, conclusion. Introduction. Hepatocellular carcinoma is the most notable solid tumor and the third leading reason for disease-related mortality around the world. It includes a multi-step process, including particular innate changes, causing adjustment of the hepatocytes. Hepatocellular carcinoma represents one of the greatest human health care issues that request novel techniques for successful treatment. Physalis peruviana is an exotic fruit highly valued for its bioactive compounds. This fruit is about 2 inches in diameter and its juicy pulp, which has pleasant smell and taste, is enclosed in 5 sepal calyces. The calyces are considered waste material after harvesting of the fruit. The calyces in particular are widely used in traditional medicine to treat cancer, infections, fever, and inflammation. Nanotechnology is the manipulation of individual particles, atoms, or compounds into structures to create new materials and devices with extraordinary properties. The challenge for all science to develop new medications from fruit waste with low cost and high efficiency in comparison to modern therapeutic drugs, which will give the improvement of anti-cancer medications to replace the present medications with many disadvantages. Aim of the work. The novel aim of this work is to maximize the knowledge concerning the use of Physalis peruviana Calyces and its nanoformulation both in vitro and animal model in hepatocellular carcinoma treatment. Materials and the methods. Plant material. The fresh Calyces of Physalis peruviana were collected and dried in an oven drying at temperature of 40 degrees until constant weight, and ground to a fine powder to improve extraction efficiency. The powdered sample were then kept frozen in -35-degree freezer until used. Then we make extraction of phenolics, determination of total phenolic and flavonoid content, analysis of phenolics by HPLC, antioxidant assay through DBPH, APTS. Then we make nano preparation, nanoparticles measurement techniques through transmission electron microscope zetasizer. The in vitro study conclude MTT assay, cell death measurement through cell cycle analysis, real-time PCR. Experimental animals, we use 24 millisprag Dowley rats, divided them to 4 groups. Each group has 6 rats. The first group is the negative control, which feed on standard synthetic diet, where the other 3 groups were induced of the liver cancer by receiving a single intraperitoneal dose of diethylnitrosamine, as the dose about 200 milligram per kilogram body weight, then divided to 3 groups. The first group called positive group, they are injected rat feed with basal synthetic diet. As the second group, it's BBC extract group. They are injected rat, feed on basal synthetic diet, plus oral intubation of BBC extract dose, which about 200 milligram per kilogram body weight per day. The third group is BBC extract nano. It is the same, the BBC extract group with the same dose. This experiment took about 4 months. Then we make, after that, blood samples collection, histopathological examination, then we made the statistical analysis. Results: phenol content and the radical scavenging activity of PVC extract. Flavonoids known as for their pharmacological activity. In this study, we determined total phenolic, which is 33.446. Radical scavenging activity represented in DBPH and ABTF methods, which was here 28.666 in DBPH and 75.45 in ABTS. Then we measure cytotoxic activity through MTT assay to evaluate the effect of PVC extract on HepG2 liver cell, which showed a high cytotoxic activity where the IC50 was 10 microgram per milli. This activity related to flavonoid content. This table showed a phenolic compounds fingerprint of PVC extract. It concludes many of bioactive compounds, which has the impact on treatment of hepatocellular carcinoma, and these compounds activity are appeared in the biochemical activity, and the biochemical parameters will shown after that. Here we made a nanoparticles analysis techniques through first transmission electron microscope, which used to measure the nanoparticle size. Here the nanoparticle size ranged from 8 to 21 nanometer. Second, the technique we used is refractive index sizer. It measures heterogeneity of the sample based on size, where the average diameter per nanometer equal 44.43, and the BDI here is 0.23. BDI is called polydispersity index. If it's less than 0.5, it means that all the nanoparticles formed are with the same shape, and we called it monodisperse, where if the BDI is more than 0.5, this means there are a broad size of distributed particles. Here, particle size is about 23.87 with percent number equal 99.8%. This table shows the alteration level of gene expression by quercetin treatment. The messenger levels of Caspase 3 was evaluated by a real-time PCR to determine the expression level of Caspase 3 in treated cells. PVC extract caused upregulation of Caspase 3 messenger RNA in a liver cell in comparison to the one-fold change in the expression of Caspase 3 in a positive control. As a PVC could induce apoptosis by increasing Caspase 3 due to high content of cyanic acid, which show high anti-cancer activity, and we mention it in the chemical composition of the extract. Here, the nutritional parameters. In this table, we determine the different effect of PVC extract and the nanoform on body weight gain, total food intake, and food efficiency. The results here showed no significant difference in initial body weight, final body weight, and the body weight gain, where there is a significant increase in total food intake and food efficiency in group 1 and group 2 compared to positive control. This increase may be associated with the strongest taste of the material we used here. In biochemical parameters, this table, we determine the effect of a PVC extract and the nanoform on apoptosis, lipid peroxide, total antioxidant, and the catalysts. All these parameters showed a significant increase in positive control compared to negative control. This believed to be the cause of the initiation of oxidative stress-related tissue injuries, cell death, and the progression of acute and chronic disease, where the two groups 1 and group 2 showed a significant decrease when compared to positive control. That may be due to the different phytocompounds of the PVC, which associated with the free scavenging radicals from tissues lead to decreasing oxidative stress. In this table, we determine the effect of PVC extract and the nanoform on pro-inflammatory cytokines and inflammatory mediators. There is significant elevation in positive group compared to negative group, where groups 1 and group 2 showed significant decrease when compared to positive control. As liver is the main center for the production of pro-inflammatory cytokines through blood, lymphocyte, and monocytes, along with cover cells, human and murine hepatocytes. Cover cells assume a vital role in the arrival of interleukin-6 through modification of MyDD88 subordinate necrosis factor trigger, which stimulates interleukin-1 alpha from hepatocytes. The diethyl nitrosamine demonstrates an impact on the cover cells and mediates the necrosis factor, which initiates the discharge of interleukin cells and induce hepatic cells and hepatic cancer. This table determines the effect of BBC extract and the nanoform on a lipid profile, which include total cholesterol, HDL, LDL, and triglyceride. Positive control showed a significant increase when compared to negative control, where groups 1 and group 1 and 2 showed significant decrease when compared to positive control. Here we determine the effect of BBC extract and the nanoform on liver function. Liver function here represent in assessment of ALT, AST, ALB, and bilirubin. They are very important endogenous diagnostic biomarker for hepatic toxicity. As shown in this table, positive group shows significant increase when compared to negative control, which attributed to the damaged structure integrity of the liver, where groups 1 and 2 showed significant decrease in the result when compared to positive control. This decrease showed improvement as all the liver enzyme mimics the normal level. A histological examination here we have 4 pictures. Picture A for negative control, which showed normal histological structure. Picture B for positive control showed the presence of centrolobular necrosis with inflammatory infiltration with periportal degeneration. There was focal hyaline degeneration of hepatocytes along with macrovascular fatty changes. Group 1 and 2 mentioned here in picture C and D showed normal architecture. Hepatocytes were unremarkable. However, it showed mild necrosis without any infiltration or inflammatory cells. This histological examination supports the above nutritional and biochemical finding. This in vitro and in vivo study, this is our conclusion. The effect of the anti-cancer powerful of BBC extract and its nanoform, and evaluated the possible mechanism of action behind hepatoprotective properties in diethyl nitrosamine induced liver cancer in rat model. Our data had shown that BBC extract and its nanoform can improve the likelihood of subsequent hepatic changes following administration of diethyl nitrosamine. It can ameliorate both histological and biochemical hepatic alterations. The present investigation put a spotlight on cheap preparation from fruit byproducts could potentially be utilized in pharmaceutical industry. It has been apparent from this study that BBC extract and its nanoform serves as successful and effective research tool, which a bright future in the management of liver cancer by using the nanotechnology. Overall, it could be concluded from this study that BBC extract and its nanoform may serve as successful and effective agent in the management of hepatocellular carcinoma. Thank you.